Well, good morning and welcome back. I'm joined by Dr. Casey Harbine for another edition of Morning Rounds. Thanks for joining us today.
Yeah, thank you.
Today we're talking about understanding hypertension. So first question, what is hypertension?
So it's just elevated blood pressure. In general, normal blood pressure should be between less than 120/80. 120 is a systolic measurement, which is the pressure in your arteries when the heart squeezes the blood out, and then the bottom number represents diastolic pressure, which is when the heart is relaxing and the pressure measured in the arteries. Stage 1 hypertension is kind of that sort of in between between full-on hypertension and normal blood pressure that requires attention and potentially treatment, and that's measured at 120/129/80 to 89. And stage 2 hypertension is a blood pressure of greater than 140/90.
Okay, so what are some causes of high blood pressure?
So, you know, a lot of it, of course, is genetics, and then as we age, our arteries get harder, and so the blood pressure measurements go up. But there are a lot of modifiable risk factors. So, for one, obesity really can increase one's blood pressure. Smoking causes increase in blood pressure. Alcohol consumption, anything more than 1 to 2 drinks a day, can really increase a person's blood pressure, and stopping it can actually show reduction. Obstructive sleep apnea, so there are probably a lot of people who don't realize they have obstructive sleep apnea, and over time this can create elevated blood pressure. And then stress also, constant stress elevates your blood pressure, and then there are some other hormonal illnesses that can cause increases in blood pressure.
Are there any symptoms, or why should we care about them?
Right, so this is the problem. Most of the time hypertension is asymptomatic. I mean, if your blood pressure gets really high, you might start having trouble with your vision or your headache, but vast majority of the time most people don't know they have it if no one's checked it. And the issue is it's a silent killer. It's the #1 cause of heart attack and stroke, and so actually paying attention right now to it will really help you down the line.
What are some of the treatment options out there?
So, you know, I think the first thing to do is if you have stage 1 hypertension, or especially if you think you're at risk for it, look at what you can modify. If you're overweight, work on an exercise program and try and figure out how to become not overweight. Quit smoking. Modify your alcohol use. If you have obstructive sleep apnea or you're worried about it, get tested and treat it. And then, you know, the other thing is if a lot of people think they have white coat hypertension, which is a real thing, right? Where you go into your doctor's office and you get your blood pressure checked and it's higher because you're worried about getting your blood pressure checked and being told it's high. The problem is, are you somebody who also gets those same kind of stress and anxiety reactions when you're driving in your car on your way home, or when you're standing in the line at the grocery store? I mean, if that's something, if you're experiencing that kind of stress all the time, then that is something to address as well, and trying to figure out ways to modify your stress through either biofeedback or meditation or whatever can actually really help as well. And then if your blood pressure is, after you've made some of those modifiable changes, is still really high, it's probably your best bet to get on a medication and to follow it and really take charge of it.
All right, well, thank you for answering those questions for us. If you have any questions you'd like us to answer here on Morning Rounds, you can email them to us, morningrounds@kpax.com.